Good afternoon, everyone, and welcome to your state capitol. We're here today to celebrate a truly amazing milestone. After years of challenges and struggle, we are seeing what real hope looks like in the Commonwealth's fight against the scourge of addiction. Just last week, we received data from 2024 showing that Kentucky saw a decrease of 30.2% in overdose deaths compared to 2023. It is hard to understate what a decrease of this size means. I remember last year when we had reported a 9.8% decrease compared to the previous year, and the type of hope that that had created, and how in 2022 there was a decrease of 2.5% from 2021, making Kentucky one of the only states that's now seen 3 years of decreases in a row. I think about 2022 being that first year since 2018 we saw those numbers moving the right way. It is a hard-fought miracle that we are here to celebrate the third year in a row that overdose deaths have declined in the Commonwealth of Kentucky, which means more Kentuckians have achieved recovery and more of our families have been saved. Thank you all for your work. However, today's celebration doesn't come without real pain. According to the 2024 Overdose Fatality Report, we still lost 1,410 Kentuckians last year to a drug overdose. That is 1,410 too many. It is 1,410 children of God, somebody's kids, somebody's parents, somebody's brothers or sisters or friends that were taken from us far too soon. These are all children of God, missed by their friends, families, and their communities. Two drugs in particular continue to be the most prevalent, contributing to deadly overdoses in the state. Fentanyl was present in 62.3% of overdoses, while methamphetamine was present in 50.8% of overdose deaths. Today, we also have another sign of hope, because I remember last year being here to celebrate an almost 10% decrease overall, but our African American population had actually seen an increase. Well, we can now report that in 2024, we saw a 37.3% decrease in our African American populations for drug overdoses. I want to thank everybody who made a day like today happen, an announcement like today happen. I remember a year ago seeing the excitement, but also the hurt, and making the pledge that everybody deserves to see that decrease, because no one wants to lose their friend or family member. This year's overdose report indicates that almost all Kentucky age groups saw a decrease, with the increase only being among those ages 75 to 84. So today I'm thankful that more Kentuckians are alive and in recovery, that we still mourn the loss and rededicate ourselves to doing even more in their honor. We'll never stop working to bring those facing addiction into recovery. All of us have felt the heartbreak of losing somebody, of having somebody's family member walk up to us at an event and tell us that that person that we know is gone. Having the wind knocked out of you, seeing the pain in that individual's eyes, and I know we're all desperate for a future where this doesn't happen to any family and none of us ever have to hear that news. This accomplishment has been a team effort, and we have partners across the state stepping up. We have a lot of people in the rotunda today that work in treatment and in recovery, and for you, we are so grateful. Many of you are in recovery yourself, and you go into the most difficult trauma of your life every day when you could be doing anything else, because it helps other people see a light at the end of the tunnel. It gives hope to those that have maybe lost hope. And so to each of you, a very special thank you for going through that, maybe over and over and feeling some of your pain repeatedly, but being willing to do so to help that next person and the next person and the next person. And everybody in the treatment and recovery community, thank you for stepping up and doing it every day. No matter how tired yesterday was, you show up and you give it your best knowing that somebody out there needs you today more than they've ever needed anyone. And I also want to thank every brave Kentuckian that's asked for help. We wouldn't be here if we didn't have the stigma having been reduced over the last years and without people willing to say, now is the time and I'm ready for help. I'm proud of everybody in this rotunda, from government to the nonprofit sector, that has made sure that cost is no longer a barrier to treatment and recovery. If you ask for help, we can get you help anywhere in the Commonwealth of Kentucky. I want to thank those that are out distributing Narcan. Last year, we distributed 170,000 doses. The answer to how many times we ought to bring somebody back who's overdosing with Narcan is every single time. Every time. Thank you to everybody who works in our 84 syringe exchange program sites. They work. That's not politics, it's a fact. And we need them to continue so we can keep helping more Kentuckians. Thank you to Medicaid. Coverage through Medicaid has been a game changer. Cuts to Medicaid could stop our progress. Last year, over 142,310 Kentuckians got help through Medicaid. Nearly 18,000 Kentuckians received recovery services in their community paid for by the Kentucky Opioid Response Effort. Let's thank CORE for all their funding and work. "19 Kentuckians sought treatment through the Kentucky State Police Angel Initiative." What an amazing program, where our state police recognized that sometimes people that they were interacting with just needed help, and creating a pathway that they could come in, ask for it, and we could move them in the right direction. I want to thank everybody at the KY Help Call Center. We had 3,320 incoming calls and made over 14,000 outgoing follow-up calls. Think about that. For 3,300 calls coming in, more than 14,000 were made in response to support those individuals. And we now have 21 counties certified as recovery-ready communities. Let's get to 120 in the next couple of years. Since day one of this administration, we have been committed to becoming a national leader in fighting this epidemic. Here in Kentucky, we believe in second chances. Helping people get back on their feet is a win-win. It helps our economy. It helps families. It's the right thing to do. We recently announced that Kentucky secured another record low recidivism rate, meaning these services that we're providing in our jails and in our prisons, and providing reentry services to provide a skill, help people secure a job, is supporting more Kentuckians than ever before. These are our Kentucky families. Regardless of what somebody's been through, tomorrow is a chance for that better life. And when we are smart, and when we are kind, and when we put these type of programs into effect and we work them and we work them and we work them, knowing that some of you have waited to see numbers like this, a decrease like this for decades, I'm just so proud of your work fighting for the inches that became the feet, that became the miles of progress that you can now see. We want to make sure that every family can build their new Kentucky home, provide that opportunity for their kids, and that we can heal families while we're healing individuals. It's important today that we continue to message that if you or someone you know is fighting addiction, today's celebration shows that there is hope, and treatment and recovery work. You'll find no judgment when seeking treatment. In fact, we'll be really proud of you. You'll be met with love and compassion To be connected to treatment, call the KY Help call center at 833-8KY-HELP. That's 833-859-4357. Before I wrap up and pass it off to some amazing people, I want to do a couple of thank yous. Commissioner Dr. Katie Marks of the Department of Behavioral Health, Developmental, and Intellectual Disabilities for her work. We got this overdose report a little bit early to help reinvigorate our battle against addiction, thanks to Megan Steele and Laura Daniel with the Kentucky Injury Prevention and Research Center. I want to thank all of our law enforcement officers, paramedics, and firefighters who are removing illegal drugs off our streets and distributing Narcan. I've seen firsthand a first responder bring somebody back who I thought had breathed his last breath to give that individual an opportunity to fix and heal their lives. I want to thank all of our state and local agencies who are on the front line, our treatment providers and peer support specialists across the state. Because of you, people can access treatment anytime, anywhere. I think we have the best providers in the entire country. How about y'all? And once again, I want to thank everyone who asked for help this year or the year before, whether it's your first, second, or 10th time seeking treatment. As long as you're trying, we're proud of you. We're here for you. We know the next time has that much better chance of being successful. We're going to show up again and again, day after day, until we ultimately end this epidemic. It arose in our lifetime, and I will not sit by and let it continue into my kids and eventually their kids' lifetime. It is our responsibility to leave a better world for the next generation. And thank you to everybody in this room that we can now see that this is possible. So let's keep going. Next year, let's try to make it just as big. And the year after that, and the year after that, because so many people are counting on us. To continue this work, today I'm signing the fiscal year 2026 Drug Interdiction and Counter-Drug Activities Plan. This is the plan that supports the Kentucky State Police and the Kentucky National Guard, as well as our federal and local partners in destroying the supply of illicit drugs in our communities. These folks work hard. During the 2024 fiscal year, they seized more pounds of fentanyl, meth, cocaine, and heroin compared to the prior year, and they also made more arrests. I'm proud of the work that you all are doing. So today, this team is represented by KSP Commissioner P.J. Burnett, Adjutant General Hal Lamberton, and the Guard's Chief of Staff Steve King. If they and all the other representatives of those agencies would please join me, I'm going to sign the plan, and then we're going to turn it over to our new Cabinet Secretary, a guy who you all know really well and has led us through a lot of challenges, Dr. Stack.
Thank you, Governor. Good afternoon, everyone, and thank you all for being here to be part of Team Kentucky on such a special day as today. Today, at least for me, I feel relieved. I feel relieved that we're able to celebrate a 30% reduction in the loss of Kentuckians' lives to the tragedy of addiction and overdose. I feel additionally relieved that in the African American community, which had disproportionately faced a higher mortality rate, and unfortunately still does, we saw a much larger decrease of 37% in the reduction in overdose deaths last year. I think it's essential, though, that we not lose sight of the people when we talk about these statistics. The people who are our friends, our family members, our loved ones, our community members. Behind every one of these individuals is a story. Behind every one of these individuals is the hope of a life full of potential and opportunity, and all too tragically, the loss of that hope and that opportunity when their lives are prematurely curtailed. This is not about someone else. This is about all of us. Every one of us in Kentucky and every one of us in the United States of America knows someone, if not multiple someones, who have suffered from the difficulties of addiction, and unfortunately, most of us probably know someone not far away who has died from overdose. This is about all of us. This is about all of our communities. It's about all of us coming together to try to do more about this so that we do not stop and we do not tire until we've eliminated this epidemic, until no one needs to die anymore from this problem of substance use disorder, overdose, addiction, and death. Our efforts and our advocacy absolutely must continue, and the governor's given statistics about the impact we've had. He's also talked about the importance of Medicaid. Folks, without the resources that have been provided to make Narcan available, to make fentanyl test strips available, to promote harm reduction, to enable those 84 syringe exchange programs, which really are much more than just that. They're full, comprehensive harm reduction programs that help identify people in need and help get them to services and supports that enable them to get on a road to recovery. Without the supports of Medicaid and the other public health agencies federally and at the state level that support this work, those things won't be able to continue. With the Narcan that we've distributed, that has saved lives. That undeniably has saved lives. It needs to continue. So your advocacy and your efforts and your outreach have never been more important than they are now, so that next year we can stand here again and announce yet another 30% or more reduction in deaths related to overdose. So at a time when our society seems too sadly and irretrievably committed to tearing itself apart, I think what we have seen here is our power when we come together. The things we can accomplish when we work together, when we don't divide ourselves, but we find what brings us in common and support our communities and support each other. And so I want to encourage us today that as we stand here in gratitude and in relief at announcing a 30% reduction in our overdose deaths, that we acknowledge and that we recommit that our work is not yet done. I want to ask each and every one of you, I think sometimes when we talk about this stuff, we think about folks like governors or secretaries or law enforcement doing things that are heroic. The most heroic thing is what each of us decide to do in our daily actions. It's how we treat each other. So in a world full of negativity and in a world full of division, please do not lose sight of your ability, your power to turn that story around, to make that narrative one of celebration and one of positivity. So please, I encourage us all as we recommit to ending the opioid epidemic, to ending the scourge of death related to overdose, that we commit to treating with each other with kindness and with caring and with compassion. Because if we do those things, then every Kentuckian truly can reach their full potential, and all of us can live in communities that thrive. So thank you very much. It's my pleasure now to introduce Mr. Van Ingram. Van is the Executive Director for the Office of Drug Control Policy here in Kentucky. There are many heroes in our story and our efforts. Van is certainly one of them. His commitment over an extended period of time in being tireless about treating this as a medical problem, as a health and a public health problem, not first and foremost as a problem of punishing people, but of supporting people and helping them on a path to recovery. His commitment and his unrelenting efforts in this area have been invaluable to our success. So, Van.
Thank you, Dr. Stack. I was saddened to hear that my good friend Secretary Friedlander was leaving the Cabinet for Health and Family Services, but it did my heart good to see that you're going to be the one to replace him. I know you led us through the COVID-19 epidemic, and I know you'll do a great job with CHFS. Well, this is an exciting day. To say we've been waiting for it is really wrong. We've been working for it. People in this room have been working for it. Our law enforcement friends have been working for it. Our friends from treatment and recovery. We've all put our head down and tried to get here. I've been in this office, later this year will be 21 years. Drug overdoses didn't ever go down until 2018, where they went down 15%. Then COVID came, and fentanyl came. And it just seemed like this is just devastating. What are we going to do? Well, we put our heads down and we all went to work, didn't we? And now for the third year in a row, there's less families that have to suffer through. 500 fewer families in 2024 than in 2023 had an empty seat at the table. That's something to celebrate. But we don't declare victory. We got a long way to go. 1,400 people still have that loss. 1,400 families had that loss. So we got lots to do. I do want to thank a few people. The Kentucky Injury Prevention Research Center, not only do they put this report together with our help, they meet with us on a monthly basis with myself and public health and behavioral health. They keep us up to date on what's happening at all times with this opioid epidemic. So it's not just a once-a-year commitment from KIPRIC. We meet with them at least once a month. The Office of the Medical Examiner also helps quite a bit, as well as the Office of Vital Statistics. So we want to thank all those folks. But mainly we want to thank folks from every corner of this state that have worked hard, whether it's a syringe service program, a recovery community center, a treatment provider, a peer support specialist, or just somebody who advocates for those that are sick with this disease. We thank you. I want to say one of the cool things about this job, well, there's a couple. One, this state really works well together. We don't do any of this in a vacuum. I meet with Dr. Stack's folks all the time, and behavioral health's there with us. Our friends in law enforcement, we all work on this together. Medicaid, always at our meetings, always pitching in. That's the really nice thing about this job. This state really works well together. The other thing is I get to meet people in recovery in every corner of this state. And the young man I want to introduce comes from a corner of this state, Paducah, Kentucky. If you haven't been there, it's a beautiful town. I suggest you go. But Brandon Fitch has been just remarkable of the work he has done in the Paducah and Four Rivers area. What he has done to bring together a recovery community center. Within that community mental health center, they also have a drop-in place for young people. They bought a van and they go out to far-reaching communities in western Kentucky to provide services. And recently, he became one of the newest employees of the Cabinet for Health and Family Services. So Paducah has a big loss, but join me in welcoming Brandon Fitch. Before I do that, I should have looked at my notes. We got a short video we want to show you, and we want you to see just how easy it is to find treatment resources in this state. The folks that work at 8338 KY Help Operation Unite runs that program for us. They do a tremendous job, and I want you to see just a little bit of what they do.
So anyone needing resources for substance misuse should reach out to the Kentucky Help Statewide Call Center. A screening and referral specialist is going to take your call. They're going to do a brief screening and collect information that's going to help them connect you to viable resources, and then they will call you back with the resources that you need, whether it be for yourself or a loved one or someone that you're working with.
Kentucky Help Statewide Call Center, this is Heather. How can I help you? Great. Now, will he have access to transportation if we can find him a place to go? And what kind of distance are we looking at for traveling? Do you know what kind of substances that he's been using? Do you maybe know when his last date of use was? And would you happen to know how frequently that he was using?
Have you been to either residential or outpatient substance use treatment in the past? Have you ever been told that you have a mental health diagnosis? Alrighty, and you're looking to get into a residential program? So at this point in our call, I will reach out to our resources that we have here. It's statewide, and I'm going to make a few calls. And would it be okay if I give you a call back in about 15 minutes and connect you with those resources?
And then in the 24-hour period, I like to call back and do a follow-up and just make sure that what I give you is going to be beneficial for him. Does that sound okay?
The process is simple. You just dial the number, call, and that's really all you do. Answer a few brief questions, and then we're going to do the rest of the work. So our hours are Monday through Friday, 7 a.m. until 10 p.m., and then Saturday and Sunday, 8:30 a.m. until 5:30 p.m. But any calls that come through after hours are monitored for crisis calls and will be returned within 24 hours.
We're very blessed in this state to have two programs, findhelpnowky.org, run by the Kentucky Injury Prevention Research Center. It's now includes mental health services, naloxone services, as well as recovery housing, and then 833-8KY-HELP. Lots of states would love to have what we have in those two programs. They do tremendous work for us. So now I'm going to turn it back over to Brandon.
Thank you, Van. He already mentioned that I am a brand new member of the Cabinet of Health and Family Services, but I want to say the most important thing for me to say today is my name is Brandon, and I'm a person in long-term recovery. You see, hope does not happen by accident. It is built one relationship, one community, and one second chance or fair chance at a time. Today we've heard about some incredible progress Kentucky has made, a measurable, significant drop in overdose deaths. These numbers represent real people, individuals, and families who get to live today. They're healing and building better futures because of Kentucky's commitment to recovery. These numbers represent proof, and as it was mentioned a moment ago, proof that when we work in the spirit of collaboration rather than competition, we can change the future. And I want to repeat some numbers that were already mentioned today because I wrote them down. As part of Team Kentucky, we're building something powerful in partnerships with communities across the Commonwealth. In 2024, 142,000 Kentuckians, Medicaid beneficiaries, received substance use disorder services. Over 18,000 Kentuckians access core-funded addiction treatment, and nearly 18,000 more received recovery support services. That's powerful. There are now 458 certified recovery residences in this state. That means there's 5,660 beds available for transitional living, and 15 recovery community centers where people in recovery can find connection, purpose, and continued support. And when we talk about support, we have to understand that when a person who has experienced a substance-related crisis like an overdose, we know that recovery is not a one-size-fits-all solution. That's why we are committed to supporting multiple pathways of recovery, because recovery is as unique as every person in this room and every person watching today. I am someone who sat on the other side of these services, a treatment client who found a path forward because people believed in me before I had the opportunity and the courage to believe in myself. Kentucky invested in me, and now I get to be a part of investing back in something beautiful, right here from Frankfort and for all of Kentucky. I am proud to stand here today as part of Team Kentucky, a state that believes in lifting people up, not shutting them out. And yes, we have made progress, but the work is not over. You see, fighting the overdose crisis is like fighting a fire. You don't stop just because the flames are 30% contained. You dig in, you push harder, you keep going until every ember is out, until every life has the opportunity and the chance to rebuild. We still have people struggling, families hurting, and we still have a lot of work to do. But today we can say without a doubt, recovery is not a dream, it is a reality. And I get it. I know from personal experience Addiction is frustrating. It's irrational. And it is scary to ask for help. But if you need proof, look at me. If you need proof, look at our next speaker, or the thousands and thousands of Kentuckians across the state that are in recovery today, and ask yourself this: if they can do it, why can't I? Why can't I? If you're struggling, hear this: you are seen, you are valued, and you are not alone. Hope is here. Recovery has never been more possible or more accessible than it is today. I'm here to tell you that recovery is not rare, it's real, and it's happening right here in Kentucky. Thank you. So I get the pleasure to introduce the very next speaker, and somebody who I've looked up to for quite some time. You see her throughout Kentucky's initiatives and advocate programs. Tara Mosley Hyde, CEO of People Advocating Recovery.
How do I follow that? Thank you, Brandon. And I mean, everyone here, I'm so grateful. I'm grateful for the moment, but more than anything, I'm grateful as a person in long-term recovery. In April, I celebrated my 14th year of being a person in long-term recovery. And it is incredible to me to see what has transpired over the last 14 years, to see where we are today, to see how we came up over the last couple of years and have collaborated, have spoken up, have worked together, have came up out of the shadows for my people in the recovery community and have spoken out, because that is hard. It is hard to talk about something so personal and so deep. And for a lot of folks, very traumatizing. And then for my families and my allies, something so personal and so traumatizing to talk about those things. But it's important. And this is why. This is our why today. The moments like today. Because if it wasn't for those stories, if it wasn't for that resilience, and if it wasn't for those tough conversations, we wouldn't be here. Because these folks here sitting on this panel didn't know. They didn't know the things that people in recovery needed. They didn't know the things that family members needed. They didn't know the things that our communities needed. And we have to be the ones that continue to talk about the things that we need. Because still, we have to work together. 1,410 lives. That's still 1,410 lives and those families that won't be able to celebrate events and celebrate holidays together this year. We have to continue working on the things that we know and the things that are working. We have to continue to collaborate and continue to work across sectors. I work at a nonprofit organization at People Advocating Recovery, and we work to remove barriers for all individuals who are in or seeking recovery. We work with Van Ingram at the Kentucky Office of Drug Control Policy all the time. We work with the Cabinet for Health and Family Services all the time. We work with Louisville Metro Police Department all the time. Work across the aisle, work across sectors, because we have to work together. This is a community problem, and we have to work together. And not only that, but we need to continue to invest in the things that we know that are working. And I'm so excited to continue in this work and to continue in this space, because we know that even at with the current federal uncertainty, I'm still excited to see all of my community members here today and their continued commitment to working in this collaborative space and working together, because that's where I want to live and where I want to stay. And I want you to know and everybody out in TV land to know that I'm committed to being here, and I will show up, and I will show up to the governor's office often, and still work together, because this is about us. This is our community, and we're here, and we need to work together. Recovery is lifelong. It's not just in the moment. It's not just a month. It's not just a year. It's not even just 5 years. I celebrated 14 years of recovery, and every day I learned something new about myself. And recovery is a beautiful thing. I get to do all kinds of amazing, wonderful things. Treatment is a chapter in that long book of life of recovery. So let's consider all of the beautiful different recovery support services that are available in our communities. Let's remember to make those connections and continue to build that community. And we will continue to do that when we continue to invest. That's all I have.
So today we celebrate this 30+% decrease in overdose deaths, but never forget that there are so many others out there that need our help. While we announced this last Thursday, it's only right to have those in the rotunda today and those watching that have put in this hard work here for this celebration. So we'll answer a few questions from the media on this topic, and then we'll open up, because I know a number of our speakers here, as well as those that work in treatment, recovery, and law enforcement, will be available to directly answer your questions one-on-one. So every year we've worked to make Narcan more and more accessible, whether that's at a pharmacy, whether it's through a lot of organizations that are out there, whether it's through state funding, local funding. Narcan saves lives, and anyone who's worried about someone that they know overdosing needs to have access to Narcan. I remember when I pulled an overdosing man from a car as Attorney General, and watching him stop breathing and not having access to Narcan, what it meant to me, and how we outfitted all of our investigators in the next week. And I think it was 3 days after that, someone had to use their Narcan to someone overdosing in a McDonald's drive-thru at 9 o'clock in the morning. Narcan is absolutely critical to have out there, and these potential federal cuts would mean the loss of lives. Less Narcan, less people we save. So we're going to continue to do everything we can on a state level, and I know we're joined by our nonprofits and others to make it that much more accessible. Because we're living in an age where, especially with fentanyl, the drugs are more powerful than they've ever been. The chance of an overdose is that much greater than it's ever been, yet still we've seen this large decrease. Right, today we talked about the decrease, but we didn't talk about the fact that we're seeing it even in the face of the most deadly drugs we've ever seen. Narcan, treatment, recovery, drug seizure are all how that's happened. So I don't want to take away anybody's efforts in getting here today. What law enforcement has done is so incredible. What Narcan does is incredible. But I believe a huge turning point in our battle against this opioid epidemic was getting it eligible for Medicaid coverage. For Medicaid being there to be able to put the dollars behind these providers to grow, to have more peer support specialists, to have more types of treatment and longer recovery services. I believe that was a game changer. That's why I believe the most serious and significant threat to the progress we've made would be significant cuts to Medicaid from the federal government. They should not do it. It would gut rural health care as a whole, but it would also significantly impact addiction services that are needed. Okay, thank you all very much.